What if I told you the biggest threat to your knees after 60 isn't arthritis? It's the quiet loss of strength that makes every step less certain and every staircase feel a little more intimidating? If you've been told that surgery is your only real option, I want you to pause for just a moment. As a physician who has spent years helping older adults regain mobility, I've seen many people avoid unnecessary procedures by rebuilding the muscles that protect their knees. Today, I'll show you 3 simple exercises that strengthen your knees naturally, improve stability, and help you move with greater confidence. Stay with me, because the second exercise targets a hidden weakness that many people, and even some healthcare providers, often overlook. Exercise number 1. The straight leg lift. If your knees feel shaky when you're walking across a parking lot or stepping onto a curb, the problem may not be your knee joint itself. In many adults over 60, the real issue is that the quadriceps, the powerful muscles on the front of your thigh, have gradually become weaker. When these muscles lose strength, your knee has to absorb far more stress with every step, making it feel unstable and painful. This first exercise is one of the safest and most effective ways to rebuild that strength without placing extra pressure on your knees. Start by lying comfortably on your bed or on a firm exercise mat. If getting onto the floor is uncomfortable, your bed works perfectly well. Bend your left knee so your left foot stays flat on the surface. Keep your right leg completely straight with your toes pointing toward the ceiling. Before lifting your leg, tighten the muscles on the front of your thigh. Imagine gently pulling your kneecap upward by squeezing those muscles. Once you feel the muscle engage, slowly raise your straight leg about 10 to 12 inches off the bed. There's no need to lift higher than that. Hold the position for about 2 seconds while breathing normally. Then slowly lower your leg back down with complete control. Avoid letting gravity do the work. The slow lowering phase is just as important as the lift itself, because it continues strengthening the muscles that protect your knee. Perform 10 repetitions on one leg before switching to the other side. As your strength improves, work toward completing 2 sets of 10 repetitions on each leg. During this exercise, you should feel your thigh working much harder than your knee. A mild feeling of muscle fatigue or slight shaking is perfectly normal, especially if these muscles haven't been challenged in a while. However, sharp pain inside the knee joint is not normal. If that happens, reduce the height of the lift or stop and speak with your healthcare provider. One common mistake is allowing the knee to bend while lifting the leg. Keep the leg as straight as you comfortably can throughout the movement. If lifting feels difficult, begin by raising your foot only a few inches until your muscles become stronger. I've recommended this exercise to countless older adults because it targets the muscles that help stabilize the knee during everyday activities. Stay consistent, and within a couple of weeks, many people notice they feel steadier when walking, climbing into the car, or stepping over small obstacles that once made them feel uncertain. Exercise number 2. The sit-to-stand strength builder. Think about how many times you stand up every single day. You get out of bed, rise from your favorite chair, stand after dinner, or get up from the couch to answer the phone. Every one of those moments is either strengthening the muscles that protect your knees or allowing them to become weaker. If you find yourself pushing off the armrests, rocking forward several times before standing, or worrying that your knees might buckle underneath you, this exercise deserves a place in your daily routine. Let's practice it together. Sit near the front edge of a sturdy chair that won't slide. Place both feet flat on the floor about hip-width apart, with your feet slightly behind your knees. This position allows your leg muscles to generate more power while reducing unnecessary stress on the knee joint. Now lean your upper body forward just enough so your nose moves over your toes. This small movement shifts your center of gravity and makes standing much easier. Press firmly through your heels while tightening your thighs and your glute muscles. Slowly rise until you're standing tall. Pause for 1 second, then lower yourself back into the chair as slowly and quietly as possible. Avoid dropping into the seat. The controlled lowering phase is where many of the strength gains occur because your muscles continue working throughout the entire movement. Begin with 5 slow repetitions. As your confidence improves, increase to 10 repetitions and eventually perform 2 sets each day. You should feel your thighs, hips, and buttocks doing most of the work. Your knees may feel engaged, but they should never experience sharp or stabbing pain. If discomfort appears, shorten the range of motion or raise the chair height by placing a firm cushion on the seat. One of the most common mistakes I see is allowing the knees to collapse inward while standing. Keep your knees aligned with your toes throughout the movement. Also, avoid shifting your weight onto your toes. Press through your entire foot, especially your heels, to activate the larger muscles that support the knee. This simple exercise closely mimics one of the most important functional movements of everyday life. The stronger you become at standing up safely, the more confident you'll feel walking, shopping, visiting family, and remaining independent. Practice this exercise once in the morning and again in the evening. With steady practice, many older adults begin noticing smoother, more confident movement in as little as 2 weeks, making one of life's most common activities feel natural again. Exercise number 3. The Side Hip Knee Stabilizer. Here's something that surprises many of my patients. You can strengthen your thighs, stretch your knees, and even walk every day, yet your knees may still feel unstable. That's because one of the most important muscles protecting your knees isn't actually located in your knee at all. It's on the outside of your hip. As we age, these hip stabilizer muscles often become weaker without us realizing it. When that happens, the knee tends to drift inward while walking, turning, or stepping sideways. Over time, that extra movement places unnecessary stress on the joint and can make everyday activities feel uncomfortable or even unsafe. This simple exercise helps retrain those muscles and improve your balance at the same time. Stand beside your kitchen counter or behind a sturdy chair. Rest one or both hands lightly on the surface for support if needed. Stand tall with your feet about hip-width apart, your chest lifted, and your shoulders relaxed. Slowly move your right foot out to the side by about 6 to 8 inches. There's no need for a large step. Keep your toes pointing straight ahead rather than turning your foot outward. Pause briefly, then slowly bring your foot back to the starting position. Repeat the same movement with your left leg. Complete 10 side steps with each leg. As your strength improves, gradually increase to 15 repetitions and eventually perform 2 full rounds. During this exercise, you should feel the muscles on the outside of your hips working. Your standing leg will also become more active as it helps maintain your balance. That gentle muscle fatigue is exactly what we're looking for. One common mistake is leaning your upper body away from the moving leg. Try to stay as upright as possible throughout the exercise. Another mistake is rotating your foot outward, which shifts the workload away from the muscles you're trying to strengthen. Keep your toes facing forward for the greatest benefit. If stepping to the side feels difficult at first, simply make the movement smaller or keep both hands on the counter until your confidence improves. I often recommend this exercise because stronger hip muscles help your knees stay properly aligned during walking, turning, and climbing stairs. Many older adults notice they feel steadier moving through the house, navigating crowded spaces, or changing direction after practicing this movement consistently for just a few weeks. Sometimes improving knee health isn't about doing more for the knee itself. It's about strengthening the muscles that quietly support it every step of the way. The choices you make today shape the way you move tomorrow. As we grow older, our bodies become a little less forgiving. The muscles that once protected our joints naturally lose strength if we don't continue using them, and that change often happens so gradually that we hardly notice it. One day it's a little stiffness getting out of bed. A few months later, it's avoiding the stairs. Then before long, everyday activities you've done for decades begin to feel uncertain. The encouraging news is that aging does not mean giving up your independence. It means becoming more intentional about protecting it. The 3 exercises we've covered today aren't miracle cures, and they won't erase years of wear overnight. What they can do is help restore the strength, stability, and confidence your knees rely on every single day. Combined with regular movement, good nutrition, healthy body weight, and consistent medical care, these small daily habits can make a meaningful difference over time. The next 1 to 5 years may look very different depending on the decisions you make today. If you continue ignoring weakness and instability, those problems often become more difficult to reverse, increasing the risk of falls, reduced mobility, and loss of independence. But if you begin taking small, consistent steps now, even just a few minutes each day, you give your body the opportunity to adapt, grow stronger, and continue supporting the life you want to live. Remember, successful aging isn't about having perfect knees. It's about giving your body every opportunity to keep serving you well for as long as possible. Thank you for spending this time with me today. If you found this video helpful, please like, subscribe, and share it with someone who may be struggling with knee pain or weakness. Most importantly, choose one of these exercises and begin today. Your future self will benefit from the commitment you make right now.